Do you know how Japan just shocked the world with what they're building? It's not a single robot, not a flashy gadget, and not a viral demo. It's something far more structural. And almost nobody is talking about how big this really is. Most people still imagine humanoid robots bowing politely or vending machines that dispense everything from umbrellas to lunches, but what's happening now goes far deeper. Inside Japan's robotics labs, AI research institutes, hospitals, and industrial corridors, a quiet systemic transformation is underway, driven by a demographic shock no other major economy has felt at this scale: an aging population and a shrinking workforce. The numbers are stark and the plans are explicit. Japan is designing whole social and industrial systems around machines because, in many places, humans simply won't be available to do the work long term. That's not hype, it's policy and investment converging on survival. Start with healthcare, because here the need is painfully immediate. Japan's health system faces a projected shortfall of millions of care workers within 2 decades. Planners estimate the country will need millions more nursing and eldercare staff, or a technological substitute for much of that labor. That shortage is why public research centers and universities are running large, randomized trials of social and care robots aimed specifically at reducing loneliness, monitoring vitals, and spotting falls before they become fatal. The evidence is emerging that targeted robot interventions paired with predictive analytics can reduce emergency incidents and free human caregivers to focus on complex care. This is healthcare shifting from reactive to predictive, where AI flags risk and robots fill persistent labor gaps. You can see the same logic in factories and logistics. Japan's manufacturers have long led in precision robotics. But the next wave is physical AI, robots that learn, adapt, and co-work with humans in unstructured environments rather than repeating fixed motions in a cage. Companies and research consortia are embedding AI directly into production lines so factories can self-optimize, predict failures, and retool virtually overnight. A necessity when the pool of available technicians and line workers is shrinking. Major Japanese industrial players are investing heavily in these edge AI systems and digital twin factories because the alternative is shrinking production or moving critical supply chains overseas. Look at mobility and last-mile delivery. Practical rollouts are happening now. Big names in Japanese retail and logistics have expanded autonomous delivery pilots across Tokyo and other urban areas. New robot fleets run scheduled routes in mixed pedestrian environments, and major carriers are trialing condo-focused delivery robots to reduce driver workload. These pilots are not quaint experiments. They're capacity solutions to the reality of fewer delivery workers and an aging, urban population that needs reliable doorstep service. Expect these systems to move from gated pilots to everyday services in the next few years as regulations and tech mature. Meanwhile, Japanese research institutions and tech groups are aiming even higher. National moonshot programs and university labs are designing caregiving moonshots, robots that can help with bathing, cooking, medication, and companionship, combined with massive health data efforts to predict illness earlier than clinicians can. These moonshot efforts are explicitly tied to resilience aims: keep more people living independently, reduce hospitalization rates, and stretch finite medical staff further. That's a social contract fueled by automation, not an optional gadget. Disaster resilience is another place Japan quietly leads. From earthquake early warning systems to AI models that forecast water levels and coordinate floodgates, municipal and national programs use AI to process sensor networks, satellite imagery, and social media in real time, turning chaotic signals into actionable responses. In Tokyo and other cities, this means AI alerts that can reroute transit, manage pump stations, and preposition resources before a flood or quake escalates. Those capabilities matter in a nation where natural hazards are constant and where the margin for error is tiny. It's also worth watching corporate strategy, because big corporate moves accelerate national capacity. SoftBank and other Japanese conglomerates have been aggressively consolidating robotics, capability buying global robotics assets and investing in both hardware and AI stacks. Those acquisitions and investments create supply lines, talent pools, and commercialization channels that scale domestic innovation into deployable products. When corporate strategy and national need align, adoption moves fast. What sets Japan apart is the human-first design philosophy. Where some countries pursue full autonomy, Japanese labs emphasize human-robot collaboration, predictable behavior, and social. Robots are being trained to read human gestures, slow down in crowded corridors, and respond politely because the goal is not to replace the elderly caregiver but to augment them and preserve dignity. That approach reduces social friction and regulatory pushback, and it creates a model of automated care that other aging societies may prefer to emulate. You'll also see Japan's approach in public space design, autonomous convenience stores, contactless retail, and self-navigating delivery units. These are not just tech demos for tourists. They are practical responses to lower staffing levels and changing demand patterns. For example, expanded autonomous delivery services in Tokyo now cover broader neighborhoods and more store types than a year ago. This is productization, not pilot theater. There are limits and real trade-offs. Japan depends on complex global supply chains for semiconductors and certain specialty materials. Sanctions, export controls, or global shortages can slow down the hardest-edge projects. Also, social acceptability matters. Privacy, surveillance risk, and the ethics of using robots for intimate care provoke public debate. Japan is trying to thread the needle, accelerate deployment where social benefit is clear while building norms and human oversight into the systems. That's why many projects pair predictive AI with strict human review, and why explainability is prioritized in the systems. So what should your viewers take away? First, Japan's robotics push is not a collection of shiny demos. It's a coherent national strategy that aligns demographic reality with corporate investment and research policy. Second, the immediate payoffs: healthcare resilience. Factory viability, reliable logistics, and disaster response are tangible and already being tested at scale. Third, Japan's model offers a preview for many advanced economies. Aging societies will either import workers or import robots. Japan chose the latter, and it's building the systems to make that choice sustainable. If you want visuals for this episode, think cinematic close-ups of robots gently assisting seniors, time-lapse of a smart factory reconfiguring a line, street shots of delivery robots weaving between commuters, and data overlays showing predictive hospital dashboards. On-screen stat cards could show projected nursing care shortfall by 2040. Site: Rakuten Autonomous Delivery Expansion, February 2025. Site: Yamato Automated Delivery Demo, August 2025. Site: and Tokyo AI Water Level Forecast Pilot -2025. Site. These cards anchor the narrative with real, checkable facts. Finally, leave the audience with a question that pushes them to comment. Are we willing to accept a future where care and companionship are mediated by machines? Or will Japan's experiment become the roadmap other nations follow when their populations age? That debate is not academic. It will shape policy, markets, and everyday life for decades.